This is the world of the campus vets.
There are some dogs that we don't understand why, but they'll have seizures within the first 3 to 5 days of having surgery. They go downhill fairly quickly.
How do you tell them apart?
Their faces are different.
At the Western College of Veterinary Medicine, students in the teaching hospital cope with a host of medical emergencies in animals small and large.
Go ahead, girl.
Today we had an umbilical hernia and a heifer calf come in, and so they want us to put the hernia back inside of her and close the hole that it came out of. This calf's never been handled by humans before. It's been out on pasture with its mom all summer, so it's skittish around humans. She was only weaned 3 days ago now, so she's been bawling a bit, and she's probably wondering where her mom is at.
The 10-month-old calf may be frightened of her, but vet student Renee Scott knows what she is doing.
I grew up on a farm, so I'm used to the big animals and handling them.
The calf was born with an umbilical hernia.
Basically, you've got your intestines outside the abdomen because of this defect in the body wall that's supposed to keep it all within the abdomen.
I can put my whole fist into it.
We're just seeing if this hernia is reducible, and I can push my whole hand up into her abdomen through the hole. So we can put it back, I believe, and it's big.
They have what's called an acute abdomen, and it's life-threatening. So as long as the hernia is reducible, in other words, you can push the contents back into the abdomen, they'll do okay. But in the long term, it's like living with a time bomb.
The hernia could turn serious fast, leaving the calf's intestines twisted and rotting. Surgery is the only option, but first they'll have to starve the calf to clear her stomach for the operation. 2-year-old Mei Ling is a long way from home. The young pug was flown in after routine blood work showed she was seriously ill.
She came in with a history of exercise intolerance and lethargy. Her blood work shows that there's something underlying.
Vet student Maureen Hollinshead helps the team conduct a series of tests to determine if it's Mei Ling's heart or liver that is the problem.
Cutest bug in the world. Okay, do you want to try it out her leg?
She's wiggly.
Very wiggly.
Associate Professor Dr. Kathy Lynn shares a secret for drawing blood from a reluctant patient.
If you can just do this, okay?
If somebody's bopping you on the head like this, it's hard to think about anything.
Surgical resident Dr. Lori McDougall goes over the test results with Maureen.
So as far as our heart thing, we've kind of dropped that now because the EKG was normal.
This blood work picture just tells us that there's liver dysfunction, but it doesn't differentiate which one it is for us.
So we take her to ultrasound.
You bet.
The vet team believes they now know what they are dealing with.
The low albumin, low cholesterol, and low total protein all are indicative of portal systemic shunt.
A shunt is a vein that is developed either inside or outside the liver, siphoning blood around the cleansing organ.
The liver isn't doing its job, basically. Over a period of time, all the toxins that the liver normally filters out aren't getting filtered out. So they're going to start to build up in her system.
Once they find the shunt, Mei Ling will need surgery to correct it.
And the mortality rate for this surgery is actually 20%. If you don't operate on dogs with shunts, 70% of them die of the disease.
I just saw them in the pet store and thought they were the cutest things.
In a nearby home, Junko Sakai has a pair of mother and daughter chinchillas, Perot and Chibi.
I guess I've had chinchillas now for over half my life.
Junko left home to start vet school this year and brought her chinchillas with her.
And it's nice to have them here because they're kind of like a little part of home.
Since the move, 12-year-old Chibi seems depressed. She's eating very little and losing weight.
When she eats her pellets, usually they take it in their mouth and they munch, 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 and they take another one. But now she tends to just pick it up and then she just sniffs it and then drops it down. The plan is to go and see the vet and see if she can figure out what's bothering Chibi. Hopefully it's nothing serious.
It's been 2 days since the isolated calf has had food or water. Her stomach must be completely emptied before faculty surgeon Dr. Peter Fretz can fix an umbilical hernia.
Her rumen could be 30 gallons. When you roll her up on her back, all of that weight will be resting on her lungs. So there's the immediate danger of fluid running out her esophagus into her pharynx and then aspirating down the trachea, leading to what's called an aspiration pneumonia.
So we're just going to move her into the induction room or the rubber room and give her an induction anesthetic, and then we'll use the hoist to get her up on the table and get her hooked up to her gas anesthetic.
Even heavily sedated, the tired and hungry calf is putting up a fight.
So we'll make a fairly large incision right over top of the hernia. You just have one sponge in your hand at a time. That'll make it a lot easier. Okay. What we hope to accomplish is to reconstruct the belly wall and then either use a mesh or just simply close the defect. The mesh is non-absorbable and stays there for the rest of her life. Try your finger in there.
Straight along.
Yeah. You can feel the sac, and then you can feel that if I leads off, you feel the ring.
Yeah.
Okay.
It's exciting to learn something new and get in there and see what exactly is going in there. You can feel all you want, but it's neat to open things up and actually see what you're feeling.
Let's just dissect right across here and see if we can leave this onlay flap on if we possibly can.
Dr. Fretz checks to see if the skin can be stretched to cover the hernia.
We're going to put a couple of sutures in and see how tight it is. We're going to close it. We're going to be able to close without a mesh, so we won't be that long.
We finished surgery, it went well, and we are now recovering her. So we have them in the padded room so they don't bang themselves up if they struggle to get up. She's listening to us, her ears are moving, so she's coming around.
Once Renee's patient recovers from surgery, she's going to be one hungry cow. Coming up, a surprising discovery during the pug's liver surgery.
It's very, very large. It's about twice as large or 3 times as it should be.
First-year vet student Junko Sakai is worried about her 12-year-old chinchilla, Chibi.
She's been having trouble eating, and I noticed it a couple days ago.
I'm gonna peek, because I hear them in there. Hi, guys. Oh, you're so cute.
Since Chibi and her mother Perot have never been apart, Junko brings them both to the clinic. But before intern Dr. Alana Shrubsole can begin the exam, she asks a critical question.
Okay. How do you tell them apart?
Their faces are different.
No. Okay. I am going to need to get a look into her mouth. Her tongue is a little red right at the back, so there's a chance that there's an overgrown tooth right at the very back. If their molars don't wear down nice and smooth, they can poke into the tongue, and then that can make it hurt. What I would recommend is we should put her under general anesthetic, and then we can get a good look at her mouth.
Is it safe? Or?
She is older, and she is an exotic species, so there are always risks.
The team performs an ultrasound on Mei Ling. They focus on the liver, looking for an abnormal vein called a shunt.
There's 2 types of shunts. The radiologist should be able to determine if that shunt is going to be outside the liver. If it's outside, then it's easier to fix.
We have caudal vena cava coming from cranial, and then it kind of curves, and I'm getting a little bit of turbulence there. So that would be one area just to focus your look. Are you guys going to do
They found turbulent flow in the caudal vena cava, which means that it's a good sign for mailing because it's an extrahepatic shunt. So we're going to go ahead with surgery.
Surgery is barely underway when resident Dr. Lori McDougall hits her mark.
I think I found her shunt.
Oh!
The vessel is larger than expected. A considerable amount of blood is not making it to the liver. The surgeons must reroute the blood back into the liver in an effort to save Mei Ling's life.
She's now standing and walking around a bit, so we're going to put a halter on her while she's still a little bit sleepy. She doesn't sound very happy here.
The calf's hernia surgery went well. Now, still groggy from anesthesia, the feisty calf is hungrier than ever. After much convincing, the 300-kilogram heifer is back in her pen.
Oh, she's hungry. That's a good sign.
You're okay, baby.
It looks like our heifer's doing good. She's up eating. It means she's comfortable. We've got her pain under control, and it looks like she'll have a full recovery.
She's eating everything in sight. It's good.
Oh my goodness.
Faculty veterinarian Dr. Denelyn Parker arrives to look at Chibi's teeth.
They're there's ridges.
The ridges are what we're concerned about.
They put Chibi under anesthetic to get a good look at her razor-sharp teeth.
She's showing signs that she might have an infection in her root of her incisors. And we'll look at her teeth, and we might trim some of her molars that look like they're a little bit overgrown. First one is kind of long, but the second one is growing right into her cheek. So I'm just going to trim that off. And I'm actually going to trim the one in front of it off as well. It was a little scary for me, too. Yeah. I hope she gets better, though. By this time tomorrow or the next day, she should be back to normal. Okay.
Oh, there you go.
She's already a little groggy.
There you go. Saved by your mom.
She'll rescue you.
I'll just hold her for a little while longer.
Okay. Give her some loving.
Yeah.
Chibi will be sent home on antibiotics to fight any lingering infection.
I'll do as Dr. Parker says, keep a close eye on her, see how she eats. If she starts losing weight, then I'll bring her back.
I don't know where's that.
The surgical team has located the shunt vein, which is rerouting blood away from Mei Ling's liver.
It's very, very large. It's about twice as large or 3 times as it should be.
The objective is to cut off the vein's blood supply using a man-made constrictor.
It's a little metal ring, as you can see, and it swells slowly when it's exposed to water. So over the period of about 3 to 4 weeks, it swells up and closes down on the shunt. If we were to tie it off all at once, then the blood backs up into the guts, which can be very rapidly fatal.
But first, Dr. McDougall needs to stretch out the vessel so the constrictor ring can fit around it. No easy task due to the sheer size of the vein.
It's enormous. Are you trying to make me more nervous? It's not working. No, I'm just amazed. That stresses me out to no end.
I didn't think that amyloid ring would actually fit around the vessel.
It was a tight fit, and you know the whole time that the vessel can rip. So we were all holding our breath a little bit.
The constrictor is securely in place. Mei Ling is moved to the intensive care unit.
Mei Ling needs to spend the night being observed. There are some dogs that we don't understand why, but they'll have seizures within the first 3 to 5 days of having surgery. They go downhill fairly quickly.
The next 72 hours are critical to Mei Ling's survival. A few days ago, Jerry Bennett was shocked to find one of his horses with her chest torn open.
On last Friday, she was eating in the feed bunk and got standing up in here and fell through, and this 2x4 went up into her chest, and 20 minutes later, the kids went out and checked on her, and we had found the wound. And Immediately we called the university, and about 2 hours later they were out here and addressed the situation. I was nervous at first that that she might have to be put down. She's my little girl's horse, so.
The vet team has already been out to see Crystal and has determined the horse will likely survive. Today they are back, hoping they can heal the injured horse. If surgery is required, they'll turn this barn into an operating room.
How's she doing? Good.
The next morning, Mei Ling is well enough to leave the ICU.
I'm gonna take her back down to her bed in the wards and then just keep monitoring her, give her some breakfast. She's feeling better. Excellent.
But Mei Ling's remarkable recovery is short-lived. What Dr. Lin fears might happen, does.
She started to have a seizure, and she had a grand mal seizure, so she lost consciousness and did some paddling. It lasted for 20 or 30 seconds.
Mei Ling is kept on around-the-clock watch. One seizure often leads to another.
Seizure after seizure after seizure is like repeated little shocks to the brain, and so it results in brain swelling, which can be fatal.
Within days of having her overgrown teeth trimmed, Chibi is back to her playful self.
Chibi's doing really well. When she got back home, she was eating about twice as much, and she's still doing pretty good, so I'm really glad that I took her.
We'll get her sedated again here and get that right cleaned up again and probably trim that edge.
The vet team prepares to treat an open wound on Crystal. To make it painless, students Heidi and Dolores give the horse a sedative under the supervision of instructor Dr. Steve Manning.
Okie dokie. Sleepy.
We're ready.
Now that the sedative has kicked in, Dolores will give the wound a good cleaning before the scalpels come out. But she's put herself in a vulnerable position, under the groggy horse, until Dr. Manning rectifies the situation.
Let's, Dolores, just maybe work from the other side, just so if she's pretty wobbly. If she stumbles forward, you'll be in a better escape route. Like. Being a veterinarian is the hardest part is the closing.
When I spray it down with a...
They decide it's best to leave the wound open instead of closing it with stitches.
It's clean, right? So we're in good shape. So I think what we need to do...
If we'd sewn it up, we would have ended up with a huge accumulation of blood and fluid and everything in the wound, and it would have been counterproductive. So we tend to leave great big wounds on the body of a horse open. So I think what we need to do is get a little lidocaine and then trim this edge.
The dead tissue surrounding the wound needs to be cut out to aid the healing. Heidi freezes the wound with a local anesthetic before she begins the intricate job.
So we'll start cutting, see how she reacts, and then maybe if she needs more, we'll give her more.
Yeah.
Coming up, Mei Ling struggles for life.
By the Wednesday, we thought we had turned a corner.
Following her surgery, the young pug Mei Ling suffers multiple seizures.
We were feeling kind of hopeful about things.
By the Wednesday, we thought we had turned a corner.
It was a fight, and we'd think we were winning, and then we'd see her go downhill a little bit again.
Early one morning, they lose the fight. Mei Ling has another seizure. This time, she doesn't survive.
Brain swelling was what got Mei Ling in the end.
It's really hard. It's my first case like that, and it was a roller coaster ride. Because you become emotionally involved, even though you tell yourself you shouldn't.
The experience with Mei Ling gave the vets valuable insight into the largely unexplored world of animal seizures.
I learned a great deal about how to manage seizures, so she's done us a great deal of good. but it's always hard to take when it's on the back of someone who didn't make it.
It'll be just in the granulation tissue somewhere.
Crystal tore open her chest on her feed box, leaving some of the exposed tissue dead. Vet student Heidi Potter attempts to cut it away to help the horse heal.
We cut away the dead tissue from the edges of the wound, then it can start healing from the outside in.
So this wound will heal two ways, right? It'll heal by contraction, where the skin edges actually come closer together. You'll also grow some new skin across that pink granulation tissue now.
And then do the two actually kind of grow together then?
Oh yeah.
Yeah, okay.
She'll have virtually no scar probably from this.
I'm happy with the way everything's going with it. I was really concerned, like I said the other day, the first time I saw it, I was really concerned that she might be damaged permanently, but everything seems to go well, so thank God.
Chibi means small in Japanese, and porong is short for pororin. It's a Japanese kids show character's name.
Are they affectionate?
Just as affectionate as rodents can be, I guess. I don't know. They're not dogs or anything like that.